What's the difference between a regular cleaning at the dentist and a deep cleaning? And is one better than the other? So first, let's talk about what a regular cleaning is at the dentist. A cleaning is also called a prophylaxis. The purpose of a cleaning is, like it sounds, to clean your teeth. You're gonna remove any plaque, any tartar in your teeth, and also any food or debris. And also during a regular cleaning, you're gonna remove any surface stains that are on your teeth. So a regular cleaning is designed as a preventative measure to prevent any gum disease or prevent your gum disease from getting worse. So the goal here is to maintain your healthy gums, because if you don't get a regular cleaning and you keep neglecting this, then this plaque or this tartar can continue to build up. Now, normally when we brush and floss at home, what we're removing is any food particles and also any plaque. Plaque is basically this biofilm of bacteria that is loosely attached to our teeth. And by loosely attached, I mean loose enough so that we can brush and floss it away. Tartar, on the other hand, is when this plaque starts to harden. It gets mineralized, it gets calcified. And this allows it to get stuck to our teeth. This is a lot harder to remove, and we can't remove it with the toothbrush and with floss. We need specialized tools to remove it. This is what your hygienist is using when they clean or scale your teeth. Now, during your cleaning, once every year, you're gonna get your x-rays taken, and you're also going to get a periodontal charting done. A periodontal charting is basically measuring the depth of your gums. So there is a thing called the sulcus. The sulcus is the space between your teeth and your gums. And this space is not attached to your teeth. And what the hygienist does is they take this thing called a perioprobe. This perioprobe is kind of like a ruler. It has these lines in it that measure how many millimeters or how deep this sulcus is. And what they'll do is they'll go around your gums and measure the sulcus of every single tooth. So when you hear them shouting out these numbers to their assistant or typing in these numbers to their computer and they tell you about the depth of your gums, this is what they're measuring. Ideally, these measurements should be between 1 and 3 millimeters. If they're in this range, then you're good. You're gonna have really healthy gums. Once you start to get to the number 4 and beyond, this is when you start to have some issues. Now let's say that you're getting your periodontal charting done, and most of these numbers are between 1 and 3, but you have a few areas that are at number 4. Now, this isn't a huge problem. It's more like a warning sign. This usually happens when you're a little overdue for your cleaning or you've been neglecting some spots. Like you think you've been brushing and flossing, but there's a few areas where you just haven't brushed so well. And usually this is common in areas where it's really hard to reach. So then you gotta kind of focus on getting these areas. But let's say we start to get higher numbers, like 5s or 6s. This is when we start to have problems because now this sulcus is getting deeper. And in other words, our pockets in our gums are getting deeper. And this is also why it's so important to take those x-rays. So when we take those x-rays, we're not just checking for cavities. We're also checking, for example, the bone level around your teeth. If we start to notice on the x-rays that your bone level has gone down or you're losing some bone, this is also a bad sign. And we can also see on the x-rays if you have any tartar, specifically any tartar below the gums. So if we start to add up all these signs, like you start to have these deeper pockets, and then we look at the x-rays, you're getting some bone loss, and then also on the x-rays, we're starting to see this tartar getting underneath your gums, then this is an obvious sign that you need a deep cleaning. Now, before I go on to deep cleaning real quick, there is kind of an in-between area where you're in between getting a regular cleaning and in between getting a deep cleaning. So for some people, for example, they have a lot of tartar buildup and they have a lot of plaque, but their gum levels are still between 1 and 3, or they might have a few 4s. Or some people are just prone to getting a lot of tartar, or they just have not gone to the dentist in a long time, but they still haven't gotten to the point where they need a deep cleaning. This is what I call a difficult prophy, or some people call it a debridement, and some people also call it a scaling in the presence of gingival inflammation. Basically what it is it's a harder than normal cleaning, but it's still a regular cleaning at the end of the day. And the goal here is gonna be the same thing as a regular cleaning, cleaning away all that tartar, all that plaque, and making those teeth look healthy again. Now, what exactly is a deep cleaning? Some people ask me if a deep cleaning or a regular cleaning is better. The answer is neither is better than the other. It's just what do you need at the time. Healthy gums are not deep. Like I said, those measurements are between 1 and 3 millimeters. So there's nothing deep to clean. You're just gonna get a regular cleaning. With a deep cleaning, this is when you have those deeper pockets, you have that tartar going underneath your gums, and the hygienist has to go underneath to clean all of that away. Oftentimes, people will need to be numb for this procedure because, as it sounds, it can be painful without being numb. Now, that doesn't mean that you have to be numb. I know plenty of patients that have gotten this procedure without being numb and they felt totally fine during it. But if you do choose to get numb, then it is going to be a painless and very comfortable procedure. But the goal here is essentially the same thing as a regular cleaning, but it's going to take a little bit more time and it's going to be a little bit more difficult for the hygienist. That's why it's called a deep cleaning, because you really have to be thorough underneath the gums to clean the area properly. Once you get these gums healthy again, so let's say you go through a deep cleaning, you get all that tartar and all that plaque cleaned out, and then the gums start to look healthier again, then you go on to having a periodontal maintenance. Periodontal maintenance is the same thing as a regular cleaning. All it means is that you've had this deep cleaning in the past. And the reason it's called that is because once you need a deep cleaning, you have something called periodontal disease. So normally when gum disease starts off, we have something called gingivitis. This is when our gums get inflamed. But when these bacteria start to go beyond our gums and start attacking the attachment around our teeth, this is when we start to get these deeper pockets, and this is when we start to get the bone loss. But once you get this deep cleaning and then your periodontal disease is under control, it's no longer this active periodontal disease. It's more a controlled or maintained periodontal disease. This is why it's called a periodontal maintenance instead of a regular cleaning. The problem is insurance companies will never consider you having a regular cleaning after having a deep cleaning. It'll always be called a periodontal maintenance. The other thing to know with a deep cleaning is sometimes it can be localized. It doesn't have to affect the whole mouth at once. Sometimes you'll have deeper pockets in one area, but everything else is normal. So then you'll get a regular cleaning everywhere else, but in that one area, you can get a localized deep cleaning. And usually after a deep cleaning, you're gonna have a follow-up after where they kind of check the gums, see how you're doing, see how you're healing. And the goal here is basically just to see if your gums are getting healthier. Now, if your gum disease gets very advanced, like let's say instead of having 5mm or 6mm pockets, you start to get pockets like an 8 or a 9. These are really, really deep pockets. And if you combine this with having a lot of bone loss, then the goal here is to save your teeth by any measure necessary. Because if this continues, then your teeth will start to get loose and you could lose all of your teeth. This is actually the #1 reason that people end up in dentures. So in this case, you might need to go to a specialist and they might need to do some sort of small surgery or something like that, where they really open up the gums and clean out in between the teeth very well. And this is why it's good to address these issues as early as possible. This is why we start off with just a regular cleaning. And if you've been neglecting it for a while, possibly like a more difficult cleaning. But the goal of a cleaning is to prevent you from needing a deep cleaning. And the goal of a deep cleaning is to prevent those pockets from getting bigger, from that bone loss from getting worse, and to keep your gums as healthy as possible. And if this keeps continuing, it's only gonna keep getting worse. So if you have really deep pockets, just know that there is a way to go back to normal and controlled cleanings, but you have to start taking the steps. And those steps start off by just going to the dentist, seeing your options, and just taking that first step of either getting your deep cleaning or possibly going to a specialist. And if you're lucky, just getting a regular cleaning. But the longer you neglect going, the worse it's going to get. Now, a common question I get is, how painful is it gonna be? How is the healing process? Well, your gums heal very, very quickly. It's not like doing a surgery on your hand or something like that. Your hand or your skin will take a long time to heal. Your gums can heal very, very quickly. And there are different anesthetic options for your cleaning. It doesn't just have to be like an injection or something like that. There are some other options, and if you want to talk to your dentist or your hygienist, they'll be happy to talk to you about them. But like I said, during a deep cleaning, you're typically numb, so you won't even feel anything. And then the healing afterwards is pretty straightforward. So essentially the main differences between a regular cleaning and a deep cleaning is regular cleaning is more of a surface level cleaning and a deep cleaning gets more underneath the gums. So one is more preventive care and one is actually treating active gum disease. Now, the only way to know which one you need is by going to the dentist because they have to do their assessment. Some signs of unhealthy gums are having red, swollen gums, more bleeding gums, or more bulbous looking gums. But just because you have unhealthy gums, it doesn't mean you need a deep cleaning. This is why you have to go to your dentist or go to your hygienist who are trained to look out for these signs and know exactly what the best treatment would be for you. Now, whether you do get a regular cleaning or a deep cleaning at your dentist, an important note to remember is you have to do a lot of the work at home. A dentist or the hygienist, they can do a lot of the work in the office, but they're only seeing you once every 6 months, possibly once every 4 months, sometimes once every 3 months, depending on your recall. But that rest of the time, you're gonna be at home having to do a lot of the work. And if you don't brush and floss and keep your teeth and gums healthy at home, then you're not gonna respond well to the treatment. So it takes a lot of effort on your part as well. Anyway, thank you guys for watching. I hope you liked that video. If you haven't already, hit that thumbs up button and subscribe to my channel below, and I will see you in the next video. Are you struggling to floss every day? You're not alone. But what if I told you there could be a better way to floss your teeth every single day? In this video, I'm gonna go over 3 potential alternatives to flossing that might be better for you. Now, first, I wanna go over why flossing is even important in the first place. Well, like your dentist probably told you, flossing